In today's Health Watch, the Trump administration is making big changes to the COVID vaccine recommendations. Health and Human Services Secretary, that's Robert F. Kennedy Jr., announced just yesterday that he is rolling back COVID vaccine guidelines for healthy pregnant women and for children. The CDC has previously recommended vaccinations for anybody over 6 months of age, so that's children, including pregnant women. So to break all this down, sort it out for us, we're joined by CBS News Chief Medical Correspondent Dr. Jon LaPook, because he always has the answers. Hello, Dr. LaPook.
I try to answer.
Try, and you do a good job
I have
on
questions.
So yesterday, Secretary Kennedy did not provide any clarification about why this is happening and why this is happening now. So can you just tell us how COVID affects pregnant women and little kids in particular?
Well, I think you have to start off with pregnancy itself,
Yes,
right? So
yes.
Pregnancy is an altered immune state, and really that altered immunity is why the mother doesn't reject the baby as being foreign. That also increases the risk of having certain types of infections and bad outcomes from it. So flu and COVID, and increases the risk not only to the mother, but to the baby and to the fetus. So that brings us to this recommendation. Now, you have to have some background. Normally, there is an advisory committee meeting. In fact, it's scheduled for June, and it's a totally open, transparent process. You have experts who are talking, you have public input, you hear about the pros and the cons, the questions.
Put everything on the table.
Put it on the table, and then the committee makes a recommendation, and they give that to the CDC director, and if the CDC director agrees, then they send it on to the HHS Secretary.
That's no longer the case.
Yeah, you said normally.
Normally, this has short-circuited that normal procedure, so now we're just hearing this recommendation, but we're not hearing the nitty-gritty details.
Or why.
Or
why he's doing it.
Kennedy says there's a lack of clinical data to support additional boosters for healthy children. What does the science say?
So I think that's something that's an interesting question, right? So the question is, if you've had COVID as a child, or maybe you've had 3 or 4 or 5, boosters, what's the incremental benefit from one more? And I think that's an open question, and I'd love to see that debated in an open forum. I think it's trickier when you talk about saying we're not going to recommend COVID immunization to pregnant women, because I was just doing a deep dive on the data. A CDC study that ended last March of 2024, was 8 months, showed that hospitalizations, kids under the age of 6 months have the second highest hospitalization rate, second only to people 75 and over.
Wow.
So they are especially vulnerable, right? Why are they vulnerable? Because as opposed to everybody else who's out there getting maybe infected or getting the boosters, they are born with no immunity. And for the first 6 months, remember, the first shot is at 6 months of age.
Right.
What are they relying on?
Their mother's
maternal antibody that crosses the placenta and gives them protection.
Wow. All right, so what could this decision do when it comes to access or even insurance coverage?
Yeah, well, so that's the big thing. If the CDC is not recommending it, then insurance coverage could go away. Right now, it's covered in most cases. We looked to see what the price difference would be. It's for kids, it would be about $57 maybe, according to the CDC schedule, and maybe about $137 for adults. So that's not nothing if you're trying to get a vaccine and you don't have a ton of money.
And COVID's not nothing either. COVID is still something. I just got my booster last week because I am over the age of 65, and I don't see the downside to getting the booster.
Right, and I think that's what you want to discuss in an open forum. And it's not just getting COVID. And you can say, well, kids generally do pretty well, but there are issues of long COVID, other issues, complications. Kids are not immune from having a bad outcome. So I think I'd like to see the open, transparent discussion.
Yeah.
All right, Dr. LaPook always has the answers that we're asking. Thank you very much.